So you may have heard yesterday we had a CAC MNA decide to leave the party. Well, first she decided to leave, and then when they found out she was talking to the Liberals, they ended up kicking her out. But she said she talked today and said the reason she left was she did not agree with and was sad or disappointed, I guess, that she'd even voted to support Bill 2. So this is the latest bill, of course, the government has introduced that punishes doctors in this province. Lyne Couture is a family physician, president of the Association of Family Physicians in the Laurentians-Lanaudiere region, and we've spoken before. Lyne, thank you for coming back on. Look, the move yesterday from the government, if we can call it something, that they said basically they want to extend a hand to doctors because this bill has gotten, I think, fair to say, just panned across the board. Doesn't matter who you are, whether you're a medical student, whether you're a doctor, whether you're a medical specialist. What did you make of what the government offered yesterday, which had to do with suspending their action on bonuses, I guess? What was your thought to what you heard?
Well, if they're going to be serious about extending a hand, what the FMOQ, the Federation of the General Practitioners, did is they asked four conditions. And those conditions are putting the Act number 2 on pause, just like the College of Médecins du Québec, the professional order asked, so we reached their position on that. Another condition that we share with the CMQ, Collège des Médecins du Québec, is to stop indicators based on volume, but look at indicators based on quality. The other thing is we believe is that the color-coded system is just it's just irrelevant. Are you really going to want civil servants to look into your file to make them put the diagnosis for you instead of your physician, to make you a green or yellow or red color-coded person? So we think this is completely inappropriate, and we want to withdraw that. And the last but not the least is definitely we need guarantees to have the staff in our office that we need. Currently, there is a shortage of they don't fulfill their promise by 25%, and that's with the people that are already have an attachment with a family physician through the GMF program. So they do not even fulfill their part of that contract. So, and there is no guarantee whatsoever in that bill. So what we need really is to move forward with guarantees to really be able to take the population together and to make sure that we give them access. That is our goal.
Let me ask, I mentioned off the top that part of what they offered yesterday was this, this bonus that they were going to suspend. They were supposed to be abolished starting January 1st of next year. They've kind of pulled that for the time being. But the second measure that's also included in this law was to scrap a 30% fee offered to family doctors to cover administrative costs of group family medicine clinics. What about that? Is that significant?
Well, 30%, it always depends on which part are they really talking about. Because right now, the fees, just let me give you an example. At this time, when I see a patient, if it's a vulnerable patient, let's make it the most expensive person that I can see is about a $60 pay. Okay. So I might see about 3 of those. So if right now in the law, which currently states for the same exam, same thing, same patient, it would be 16. So if you add a 30% bonus on the 16, you don't get nowhere close.
You got $4.80. Wow.
Exactly. So it looks, from a far perspective, if you don't know too much, but if it's just that, you already understand with me that it's quite not sufficient, of course.
Where are we in talks? I mean, I saw Hélène Duranceau, so she's with the Treasury Board, suggest, let's come back to the table, let's talk. I mean, I've heard that before. It's not worked out up until now. What needs to happen here for that to even have any effect at all, the idea of going back to the table?
Well, like I said, to put the law on pause, to start talking about indicators based on quality instead of volume, get a guarantee with the staff and drop the color-coded system that would be operated by a civil servant who has nothing, no qualification to make diagnosis, but they will have the entire legitimacy to go into and look at your file. Are you comfortable with civil servants looking at your file and not, being under a plea of secrecy? I'm not comfortable with that at all.
Can I ask again? I'm referring to what Hélène Duranceau said yesterday. This is her quote. She said, "There are many things to discuss. There are many nuances. Let's give ourselves the time to understand those and explain things well. We won't negotiate here." What nuances? I mean, there's some very obvious stuff in here. Is it not the obvious things that are holding this up? What nuances are there, do you think, that she's referring to?
Well, it would be nice to ask her because I'm not in her head, but as we said, we certainly are available to go back to negotiating table, but we have to make sure that we're not just going to negotiate the salaries or things like that. This is not enough. I mean, it's not the bonuses. It's really the way we're going to take care of the patient that is at the heart of this law. Because right now, they passed that law under bail, saying that it was an emergency. Yeah. It was urgent to pass that law, and now they want to take their time and negotiate. We've been negotiating with them for the whole summer, for the whole last year, and they wouldn't listen. So at this point, we believe that they have to make a few steps forward with what I've just said, putting the law on pause, the indicators, the color-coded, and making sure that we have the staff that we need. And, otherwise we go to arbitration process. There are things that were there still to get out of that dead end.
Can I ask, with respect to your colleagues, I know the story, of course, last week was we heard about 100 doctors deciding perhaps to, consider leaving. The number is now up over 300 doctors. And, of course, after Doug Ford had that ad out inviting Quebec doctors to simply call him if they wanted to come practice there. What are you hearing from your colleagues with respect to, not just frustration with this and the fact that the government is not backing down, but with this idea that, maybe they'll just pick up and leave or retire early?
Well, many things. First of all, a lot of people are actually losing their physicians right now. My brother just told me yesterday that he lost his physician, his family physician. It is not the only one. I know it's happening right now to many people in the population, and it's really sad. But again, that is the reason why we urgently need to put this law on pause. It's to stop that bleeding, because the physicians are not just in dismay, not just devastated, but I would say depressed. And at some point, some people just feel that they have to save themselves and either go to retire earlier or to change province where they feel that they will be appreciated more. But mark my words here. I'm not encouraging any physician to leave the province. This is definitely not what I'm doing right now. I'm just, looking at what's going on right now, because it's really sad when people do lose their family physicians, and it's sad for the population, and it makes a even greater burden on the shoulders of the remaining one. So that is why we urgently have to put that bill on. Well, it's not just a bill now; it's a law, to put that law on pause. And, sit down, look at the things that we really need to do to work together and to rebuild that health system in order to make sure that we do serve the population right. That is what we want, the family physician.
And that's where we will leave it. Dr. Couture, I very much appreciate your time. Thanks so much.
Thank you for having me.
Yeah, Lyne Couture, family physician, president of the Association of Family Physicians in the Laurentians-Lanaudiere region. No word from the government. Well, that's not entirely true. The word from the government, from the premier, is no, we're not taking this back. It's a law now, as she said. So the idea is it would have to be suspended. It's not going to just disappear. Government doesn't look like it's in a rush to do that either.
The biggest songs in the world. You've heard them countless times. Now, learn the details of how they came to be. Join Ruby Carr for Encore, the stories behind the songs you love. New interviews and newly unearthed archive footage make for a fascinating weekly deep dive. Stream Encore, the stories behind the songs you love on iHeartRadio or wherever you get your podcasts.